Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
There are so many things that can impact the health of your hair, and in particular when we look at the growth of hair. So I want to talk about some of the factors that play a role into this. We certainly know that nutritional deficiencies and things like vitamin D, zinc, for example, vitamin E are going to be big contributors to loss of hair, thinning of the hair, and really the lack of growth of hair. So I want to talk about some of the science behind it, common reasons as to why people can experience either slow hair growth or other problems that can arise that actually impact the health of your hair. So I'm Amanda Williams, MD, MPH, and let's go right to it. Let's talk a little bit about the science. Back in 2005, the International Journal of Dermatology was looking at the rate of hair growth, and what they recognized was that many of the studies that had been conducted were actually not looking at the right things or in the right manner. For example, they recognized that even between different races, there were many factors that could impact the growth of the hair. So they recognized that Caucasian hair differs from Asian hair, and African American hair differs from, both Asian hair and Caucasian hair. So this was an area of research they really didn't look too heavily into. And then the other thing that they didn't look heavily into was the dietary impact, and recognizing okay, for people who actually had poor dietary intake, people who were following a standard American diet, certainly their hair growth was much less than in countries where their intake of fruits and vegetables were much greater, and hence they had healthier hair growth and healthier hair in general. So there's a lot of different variations, and the amount in which your hair grows can be affected by so many different aspects. So, when you're looking at average hair growth rates, it's going to have so many different variables. I mean, there's some that will say, oh, well, yeah, your hair should grow, 4 to 6 inches every single year. But there's a lot of different factors that are obviously going to play into this. We certainly know that hormonal implications are going to also have an impact on this. So not just looking at, issues with testosterone, but also when we look at issues with, say, insulin and glucose. For example, thyroid dysfunction certainly can play a role into the health of the hair. So in general, we know that, chemicals certainly can impact the health of the hair. Stress is a huge player. I mean, there is a condition known as telogen effluvium, and telogen effluvium is actually hair loss that is due to stress. And there are many different reasons as to why this can be brought on when we look at, different disease states. Certainly we can look at why telogen effluvium can occur, and recognizing that certain medications can create this stress to the hair follicle, which actually creates shedding of the hair. Beta blockers, antidepressants, and we know that beta blockers and antidepressants are some of the more commonly prescribed medications, especially here in this country. So you're looking at your things like metoprolol, propranolol, the SSRIs, things like Prozac. And this is an area oftentimes that people don't even realize. Maybe this is what's impacting the growth of your hair. NSAIDs certainly have been linked to impacting the growth of the hair. So your ibuprofens, things along that line. And they know that when we remove the different stressor or the thing that's exacerbating the loss of hair, then hair will start to come back. But for many people, they never recognize that maybe it was their beta blocker that they're on for their hypertension, which is actually creating hair loss. Then you partner that up with improper nutritional intake, and that certainly is going to have an impact as well. So we know that males generally have faster hair growth than females. We recognize that between the ages of 15 and 30 is usually when hair is growing at its fastest, and then it does begin to slow down. But there's so many different aspects. There's, underlying health conditions, as I mentioned, things with thyroid dysfunction, diabetes, heart disease, and obviously nutritional deficiencies, zinc deficiencies, vitamin D deficiency, not getting adequate vitamin C, for example, because we know that we need that for the cross-linking of collagen, and we certainly know that collagen plays a role into the strength of the hair itself, as well as vitamin E. And so one of the areas that I look at when people say, well, my hair is not as thick as it used to be, or I just don't feel like it's growing the way that it used to. Well, some of it can be an age-related thing, but we also want to make sure that we're covering all of those bases. So I always encourage you to make sure that you have all of those hormone levels assessed to see, is there an underlying thyroid issue? Is it a medication that you're on? If we can rule all of these things out, then let's look at, what can we do to change up your diet to make sure that we're getting adequate healthy fats and those key antioxidants coming from fruits and vegetables, and adequate amount of magnesium and zinc into your daily routine. But then also adding in things like tocotrienols, which we know are incredibly nourishing to the hair shaft itself and help to enhance the overall growth of the hair. So for many people, once they start utilizing tocotrienols and even just a really good multivitamin such as the core multivitamin, they'll be like, wow, just in a couple of months, my hair feels so much different. I had also mentioned chemicals, making sure that you are not, once again, adding insult to injury by putting chemical-laden shampoos and conditioners or any type of hair product on your hair. You want to be using things that are coming plant-based, things from nature. So looking at the Invite Health shampoo and conditioner. And we also have something that is really, really beneficial, and that is our hair and scalp stimulant. Now, this is just a fabulous formulation of all of these essential oils coming from things like rosemary and lavender. It has apple cider vinegar in it. It has lemon peel extract and sage and nettle, all of these wonderful nutrients that help to nourish the hair from the outside in, which is certainly key. We always want to go inside out, so making sure that we're getting the right fruits, vegetables, healthy fatty acids into our daily routine, taking, a good multivitamin, but then also having that topical approach as well. Now, with our hair and scalp stimulant, this has arginine in it. Now, arginine plays a really crucial role when we think about our vascular system with enhancing nitric oxide to allow for good blood flow. But when we look at it for hair, it does a similar fashion. It allows that hair follicle to open up so that hair itself can start to properly work its way out. And when it's surrounded and nourished with all of these wonderful, free of alcohol, free of colorants, free of fragrance, none of the chemicals, it has all of these wonderful herbs and plant extracts, it really helps to support that life cycle of the hair itself. And this is why for many people, they will have this as part of their daily routine. So they'll wash their hair with the Invite shampoo, and then they use the hair and scalp stimulant. You apply it right to the root of the hair, and you kind of just massage that in. It allows that arginine to let the hair shaft itself open up, and then we're allowing all of those things, the aloe vera, the green tea, the apple cider vinegar, rosemary, all of those nutrients to then absorb in to help to support the health of that hair. So there's a lot of different things, like I said, that really influence hair growth, and certainly many of those we can narrow down. We can look, hey, is your nutritional intake lacking? Then what do we do? Well, we change up the diet. We make sure that you are trying to adhere to a Mediterranean diet. We make sure that you're taking a comprehensive, complete multivitamin, multi-mineral formulation, such as the core multivitamin or the men's multivitamin or the women's multivitamin, and making sure that there's not those underlying factors that potentially are impeding the growth of the hair. If we know that medication is a factor into this, maybe a medication that you're on, then perhaps that's something that you can speak with your physician about other options. Is there a different type of medication that you can use that's not going to have such a negative impact on your hair itself? So all of these different ways, we have to make sure that we have a two-pronged approach to this, that we are hydrating from the inside out, but also topically. So using that shampoo, conditioner, and the hair and scalp stimulant is the topical approach, but then internally making sure that we are getting the right things. Those omega-3 fatty acids, your B vitamins, all of those things really can make a huge difference. And if we know that there are vitamin deficiencies, mineral deficiencies, is addressing those. Certainly if you have higher stress in your life, is trying ways to manage that stress can really make a huge difference. Because like I said, when we look at telogen effluvium, we know that stress is the main point of that. And so if we're having thinning of the hair in certain areas due to that stress, we want to try and make sure that we are, targeting that component and addressing that all at the same time. So many factors that can impact the overall health of your hair, but there are many things that you can be assessing in terms of blood testing, looking at those hormones, looking at vitamin and mineral deficiencies, and of course, making those lifestyle modifications to help to support the health of your hair. And definitely go with clean products, which is why I advise the Invite Health shampoo, conditioner, as well as our hair and scalp stimulant. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.